Welcome to the Blockchain in Healthcare Today Platform Approaches Journal podcast series, where research and innovation collide. Our guests today are Ken Ebert, CTO, IndicioKeela Rose Shatzkin, President and CEO, Shatzkin Systems, and our esteemed moderator, Daniela Barbosa, General Manager, Decentralized Technologies, Linux Foundation, and Executive Director, Linux Foundation Decentralized Trust. They'll discuss technologies and applications for decentralized identity in healthcare. Now let's listen in and learn what the market is doing.
We have, two experts who really go deep in on the technology and the implementations. But I was wondering if maybe we can start with, discussing and defining, what the role of decentralized identity in healthcare really is, or really what we've been seeing in the market. And I think by defining what decentralized identity is first might be a good spot. So Ken, can you help the audience understand what decentralized identity is, and specifically in use cases in healthcare?
Sure. Decentralized identity involves the use of verifiable credentials to establish the identity of a person or a care provider in the healthcare. The decentralized identity is not a centralized database. It's where a verifiable credential is held by the patient themselves or by the provider, whoever the identity is for. They have the ability to hold that data in their wallet and share it when and where they want with someone who needs to verify it, whether that's a hospital, a care provider, or any other type of clinic. Whatever type of information is needed, they can share that with their own consent, and it can be verified independently by the verifier by looking up who issued it and using cryptography to prove that it hasn't been tampered with along the route. Verifiable credentials make it so that the data can be independently verified by any verifier, so they don't have to keep coming back and talking to the issuer to find out who the patient is. The patient has that information and can hold it, and gives them complete control over their own privacy and security of that patient identity. Patient identity can contain fun things like not only their name, address, and identifying number, but it can also include biometrics if that's desired.
Okay, great. Keela, do you have anything to add to that definition?
Yeah, well, I think if we talk about what that means in a healthcare industry and the healthcare space, what that could look like is, and maybe this is an experience that our listeners are familiar with, you go to the doctor's office and you walk in and you talk to the front desk and you have to practically shout your personal information across the desk at somebody to say, I've arrived, here's my name and my date of birth and all of this other information, my address. And I think that these kinds of credentials allow for a scenario where you can walk up to that front desk and through exchanging that identity credential, share that information in a secure, private way that allows the verification that you are who you are. They can do a biometric, as Ken was saying, with you standing in front of them that's linked to your credential. And that really changes that entire user experience. So that's a really good example of how these identity credentials can really support a healthcare scenario. Similarly, you could think about a referral for care. So you start at one clinic or one doctor's office, and they're referring you to services, maybe a specialist like a dermatologist or a cardiologist, and then being able to show up at that specialist, again, without having to sort of shout your personal information. That information can be trusted by the issuer, who was the initial provider you saw, who's referred you to a specialist. They might be able to issue you that identity credential so that the dermatologist or the cardiologist knows exactly who you are just by verifying your credential. So that's just one very common use case that might occur. There are some others around decentralized identity in the healthcare space just worth mentioning. For example, patient consent and managing consent choices and release of information are really important. You have to know, are you releasing that information on the correct belly button, the correct individual? And so having that identity credential that's tied to their person is really important as the core data set to be able to unlock more information and sensitive health data. And then similarly,
Keela, I think it's really interesting that you mentioned that, because that data can be brought to a referral doctor, or it can also be brought to the travel ribbon where they need to see proof of a yellow fever vaccination or a COVID test that indicates that you're safe to travel. That type of information is not normally consumed by those outside parties. And so having a way to reliably and safely transmit that data to those other external parties allows for the healthcare data to become accessible to those organizations without having to do a direct integration back with every healthcare organization around the world.
Exactly. Great segue. I think there's also another scenario for maybe other people thinking about healthcare, not so much at the patient level, but there's also providers and the identity of a provider and the verification of a provider, the credentialing of, is that provider fully entitled to work at XYZ facility? Do they have all of their insurances and their board certifications and their, credentials with a lowercase c to be able to work at a given institution? That's another really interesting use case for using decentralized identity to manage the provider scenario as well as a patient scenario.
Right. And removing some of that friction and the existing processes of a nurse, for example, going from one state to another, not to go back to COVID, but another use case, right, specifically where we needed, nurses and doctors to be able to practice across borders, and it became very hard to do so. Had this provider credentialing been, available, then the friction would have been reduced. And from a safety perspective, making sure that the right verified doctors and nurses were able to practice very quickly as well.
Yeah, and I think it's important to just highlight that friction is here today. I mean, you have healthcare institutions with entire departments their job is to review and stamp documents that say, yes, this is a board certified license, and yes, this is a malpractice insurance. And so those friction points, while we're talking about, specific points of change with the pandemic and other sort of catalyst moments, they're still very much in our day-to-day life. And these are opportunities that we're going to be faced with chances to fix.
Yeah, well, certainly, and thinking, speaking to healthcare providers who might be listening to the podcast today, around the value of patient identity within these trust networks, right? Getting the right patient, the right care that they need, but also things like reducing fraud, right? Making sure that so maybe Keela or Ken, if you have some use cases and examples in that application, that would be great to hear about those.
Yeah, I can start, and then Ken, if you have more to add. I mean, I can tell you a story about a federally qualified health center in the Bronx who has experienced the scenario where somebody walks into the waiting room. We already discussed, they sort of shout their personal information across the desk, and then they sit down and they wait to be called into the back. They were experiencing that there was sort of a bait and switch happening. They'd come with their buddy who had insurance. That person would check in, and then somebody else would be taken in the back to see the provider because they're the one that really needed health care delivered. And so that is a type of fraud, certainly, that needs to be addressed. And that the introduction of an identity credential might reduce the friction points at Ken, do you mind going on mute for a second? Might reduce the friction points at which the patient can be verified at the front desk. They can be verified when they're crossing the threshold from the waiting room into being brought to the back, when the provider walks into the room. And so you can start to add these additional checkpoints to make sure you really know who's sitting in front of you with an identity binding credential that would allow for that to be eliminated. There are other scenarios, of course, where people might borrow insurance cards and other things, but that's certainly one that I know about personally happening in the Bronx in New York. Ken, any other scenarios around fraud?
In travel, it was estimated that one country that was receiving healthcare data, that 40% of the certificates that they were receiving were fraudulent. They'd been doctored and and photoshopped and basically changed. So allowing for a verifiable credential to be used in those use cases as well made sure that the data really matched the person who was using that for travel purposes.
So I think that, we might come back with other use cases and applications as we go through the conversation, but I think that's a really nice, level set of the kind of use cases that we think we could see from decentralized identity in the healthcare space. So let's get a little deeper. Let's get a little deeper into these discussions around the technology, right? So as healthcare providers and technologists and leaders are thinking about decentralized identity within their products and services that they offer in the marketplace, let's talk about what the key technologies are to enable decentralized identity. What does that stack look like? Maybe Ken, you can get started with giving us a nice summary of that.
So the foundational bit is a blockchain. The blockchain is used to record not any PII or personally identifying information, but it's used to record things like public keys and decentralized identifiers of issuers in particular. This allows for that information to be public, immutable, highly available, readily accessible, and publicly corroborated. The idea of that's the foundational bit. The three key roles are software agents. An agent is a piece of software that acts on behalf of a person or organization. There are three key roles. The key roles are an issuer, that's the creator of a verifiable credential. The holder, that's typically the patient or other human involved. And then there's a verifier agent. The verifier agent needs to have data about the person to make a decision. That data comes in the form of a verifiable credential. When an issuer creates it, they sign it, they give it to the holder, and it sits in their holder's wallet, typically on a mobile phone or other type of device. Then that's in the control, and only with consent, the user shares that data to the verifier, and the verifier can then look up on the blockchain the public keys of the signing organization. They can verify that it's a trusted organization, that the data hasn't been tampered with along the way, and then they can make a business decision acting upon that data. And so those are the three main roles. There's one more role, and that's governance. And governance determines who are the trusted parties in the ecosystem. That allows a verifying organization to say, is this coming from a trusted source? And they can include as many or as few trusted parties as they wish to make their decision on about where that data came from and whether or not they trust it enough to act upon it. Those are the technology bits of it. The software typically is incorporated at the issuer side in the form of an agent that sits alongside one of their servers. In the mobile, it's an application that the end user can use, and it might be sponsored or given out to them by the hospital or healthcare organization. The verifying software is again incorporated into their systems. The desk clerk may have a software that does the verification to allow the patient to come in and receive treatment, but they may not know that it's verifiable credentials. It's all hidden behind the scenes for them. And so those are the key technology bits and pieces. The key thing that organizations need to do is determine what type of data needs to be shared. Is it identity data? Is it healthcare information? Is it insurance information? And those can be encapsulated in different credentials that flow through that ecosystem.
Okay, that's a great summary. And ultimately, a lot of these key technologies are already in production in many use cases around the world in the healthcare industry as well. So we have production-based implementations that we can point to folks who might not be deep in the technology stack as well. And I think one of the key things that you said there, Ken, and Keela, I know you taught, you spent a lot of time with patients kind of in rooms, is that the patients and even the healthcare providers don't actually need to understand the technology behind it. They don't need to understand and be able to define what verifiable credentials are, or even blockchains or agents, right? These are things that really from a technology perspective become commonplace, like going on the internet or sending an email, right? These become common protocols, and technologies that power these systems as well. So one of the things I think is important, and certainly something that's very important to us here at the Linux Foundation, is the role of open source and standards and community development to these projects, right? The technologies that really drive these implementations as well. So I was wondering if we can shift a little bit. We've talked about use cases, right? We've talked a bit about the key technologies that are enabling those use cases. To talk a bit about the role of open source standards and community development, and why it's important specifically to the healthcare industry as well. Ken, maybe you can start off with a little bit around, blockchain and decentralized identity protocols, and then we can talk a bit about the healthcare specific open standards that we see there.
So there's standards that coordinate the blockchain at the very bottom. Hyperledger has been a great place for that. It's now named a new name of Digital Trust, but the organization is still the same, and they've been key in establishing a forum for discussion of the standards and how they get incorporated into real life applications. That's also fostered the development of open source projects. Open source projects allow for sharing of the core technology between many organizations in a way that promotes interoperability. And I think that's a real key aspect of what Linux Foundation Decentralized Trust has done to enable the sharing of that among many organizations around the world, whether it's used for healthcare or other things. The beauty of it is because that standard is open and available, it's used for travel, it's used for finance, it's used for healthcare, and it provides a lower cost way to get these verifiable credentials into common use and into practice. There are standards around the credential formats, the protocols used to exchange things, the cryptography that underpins the whole bit, and that allows for all of those pieces to play together nicely in a standardized way that's safe and secure for both the organizations that are using it and for the individuals who are participating. And it instills trust and enables a safe decision to be made to incorporate these technologies. There are other standards that are particular to healthcare, and Keela, you might want to talk a little bit more about those.
Yeah. So in the healthcare space, largely the healthcare interoperability standards are overseen or facilitated, maybe is a better word, by Health Language 7 or HL7, which is an international standards body for healthcare standards. They are responsible for many generations of healthcare standards with different purposes. The most recent standard development is called FHIR, spelled FHIR, Fast Health Interoperability Resources. And there is a tremendous amount of promise, I think, around the intersection of FHIR and verifiable credentials. We'll get into that in a little bit. But it really breaks down sort of by subject area a little kernel of information that you might exchange for a specific use case in healthcare. And so they're really important internationally in driving sort of those data exchange and communication structures and content. They call them value sets in FHIR. I think it's important also, especially from a U.S. market, but I think as internationally as well, around governance, because healthcare is a very regulated industry. We need to talk about how governance also intersects beyond just developing standards of how do you do something, but what do you need to do and when do you need to do it, and sort of under what parameters. And so in the U.S. industry, we have the Office of the National Coordinator, which is a federal body that is governing certain healthcare interactions and requirements for healthcare facilities, as well as the Joint Commission, who regulate healthcare facilities around certain activities, certain communications that are happening. For example, you must notify the primary care provider after a hospital stay. This might be the guardrails, and then exactly how you execute that, you would manage through the standards that are available to you, such as HL7.
Okay. Right. So there's certainly a lot, and I'm sure the audience of Blockchain and Healthcare Journal probably understand a lot of these standards and specifications, and they're not new, right? These things have been around for a while. And even as we think about blockchain and agents and decentralized identity, this has been work that has been going on, at least here at Linux Foundation under LF Decentralized Trust and previously under Hyperledger, as well as a trust over IP, where this work, both on the code and the standards, has been working on. So, would love to hear from both of you as to kind of what are the driving forces behind moving these open sources and code bases and standards forward within the healthcare community? What's next? Like, how can the community push these forward?
I think this is where that intersection to the regulations really plays a significant role, because there is so much regulatory oversight around how money is spent, how electronic medical records are working, the things that they must do, and their certifications as technology tools. I think that there needs to be some drivers in terms of that regulatory space, whether it's innovative projects, right? There's sometimes reform programs like a Medicaid or Medicare reform incentive program. There are some creative outlets for that beyond just mandated regs that will allow for this advancement, to say this isn't just interesting, it doesn't just have promise, but this really can solve problems for us. And I think we need that to help be a catalyst to move us into deployment, because it needs to go beyond just one facility or one vendor or one healthcare system deciding that that's what they want to do, because it requires that ecosystem around governance and a community of issuers and verifiers. It really, I think it'll take that regulatory push.
Yeah.
I think to get to the regulatory push, I think a successful pilot program or proof of concept really helps illustrate the benefits to all parties involved, the issuers, the patients, providers, and the organizations that employ them. So I think that that's a really good stepping stone to actually making this more widely available, is to demonstrate its usefulness in a small microcosm.
Mm-hmm. Yeah, and we're really looking across, other industries that, where regulation has really driven, from a sustainability or traceability perspective as well, where we see very clear regulation that is helping the innovation that's been happening in the ecosystem actually go into production and really, bring those values. Which I think is very, very hopeful for us who have been at this for a while. And Ken, I'll throw the same question over to you, but specifically on the technology side, as you've been very deep as in the tech, where there's always been questions of scalability, for example, especially when you're handling millions and millions of credentials potentially. Talk to us a little bit about maybe where, from an industry perspective, we are with that.
So the scalability is early on was a bigger issue than it is, I believe, now. The scalability testing that we've done scales out to very, very large numbers. The real life deployments are starting to grow. That's a solvable problem. And I think that you're going to see more and more adoption and smoother implementations as more experience is gained there. I think the real thing is to find out where the smaller microcosms of an ecosystem can be deployed and then scaled out from there. And never start trying to boil the entire ocean. Pick a small project, deploy it successfully, and then scale it up from the success that you see there. It's better for selling it to the benefits to others so they can see tangible results, and that really helps move the needle and make things gain adoption much more quickly.
And it goes really aligned with what Keela was talking about before, which is the governance requirements as well, right? It's not just the technology. We know that the technology does work, can scale, can continue to evolve based on what use cases need. But the governance of these networks, it really becomes a critical aspect of success in the marketplace as well. So let's talk about success a little bit, about where are the two of you seeing traction specifically?
I'll start first. Travel is the greatest adopter so far, and the reason is that they have the most pain. They have the greatest need for adopting the credentials to ease the flow of passengers through travel, particularly international travel. And that allows for them to make better utilization of their aircraft, their airport space, and make for more secure borders. The traveler gets a benefit out of it with the ease of travel and the security it brings them to know that they can be pre-cleared to cross the border. So they have the greatest need. I think secondly, you're seeing financial services because of the reduction in fraud that can be achieved and the greater assurances that you're actually dealing with the right person on the other end of a transaction. So those are the two industries that I think are moving the fastest. Education is there as well. Healthcare has typically been a little slower in the world because of the high security requirements that they have and the slower pace of change that they can support in all of their various systems. But I think that the need there is also strong. Keela, why don't you share your ideas about what you think is going to happen?
Yeah, I think it's interesting, again, sort of in a US frame of mind, we have relatively new regulation like the 21st Century Cures Act that says that patients are the owners of their healthcare data. And so while I think, I'm still waiting for some regulation to be the push that gets us there, I do think that things like the 21st Century Cures Act that say the patient owns their own data are starting to build this new mindset around how do we unlock data from these silos of healthcare facilities and get it into the hands of the patient so that they can be the one that brings it with them where they need it and when they need it. And so I do think that while it's slow in the healthcare space, we'll start to see verifiable credentials and identity credentials start to touch healthcare around, okay, let's at least make sure we've got the right belly button. And then we'll start to see more comprehensive health chart exchange being initiated by the patient themselves. So I think we're there slowly. We're starting to see the patient safety benefits around it as well. And the fraud, I think, is a big one, especially as we start to think about how do we reform some of the financial challenges in the healthcare. That will probably be a significant driver because the money is where the attention is, I think, unfortunately.
Sure. I really like the law of the land is that the patient owns their own data. And once that's clearly identified, and it makes it much easier for the implementations of the use cases we talked about, for sure. It's a central piece of the puzzle for success in the healthcare industry, for sure. So, I think we've covered quite a bit in regards to, some of the key use cases, whether the key technologies, the roles of open source and standards in community development projects. We're all very deep in this, I think, from multiple angles here on today's podcast. And would love to kind of think about like, what comes next, right? What should people be looking towards in the next, 6 and 12 months? And let's say we have this conversation in a year's time, right? And what should the audience be on the lookout for?
Well, I can start from from a healthcare and how it intersects with credentials. I think that we need to get to a place where FHIR, which is our healthcare, the latest of the healthcare international standards, can intersect nicely with a verifiable credential. And if we can get to that intersection, I think that we're going to unlock a huge opportunity to really open the doors for verifiable credentials in the healthcare space. Because right now we've got these sort of competing, are we doing FHIR, but verifiable credentials is really cool, and how do we intersect them? If we can solve that technically, we've unlocked the door, I think, to make this move forward really in the healthcare space. Ken, I don't know if you want to talk more about like how that happens technically.
The merger of FHIR with the verifiable credentials, I think, is possible, and I think that if you come back in a year, I hope that you'll be able to say, look at this one case where an institution has deployed a verifiable credential containing FHIR records to identify a patient and to encapsulate a referral from one organization to another. And if you get to that stage, the floodgates can open after that.
Absolutely. I think we're also, given the current climate and regulatory change happening in the US at this moment in healthcare, I think it also is an opportunity for significant change from that perspective as well, right? We've got Medicaid reform sort of looming, Medicare reform, a lot of financial changes happening in healthcare. And I think those all create opportunities for us to find more efficient ways to do and redesign what we do. So this might be a really interesting moment in time for us to take advantage of verifiable credentials and sort of unlock that. But it is interesting, just as one point, there's so much centralization happening in healthcare with big EMR vendors and big healthcare systems. They're sort of like taking over their regions. How this decentralized model is going to intersect with that really competitive consolidation of healthcare. And that's another area I'll be paying attention to over the next year.
Okay, fantastic. Ken, anything to add to that?
I think that the identity portion of it will be the natural starter, and then digging deeper into exchange of records will follow. But the identity portion of it is key to the fraud reduction that I think that the reforms will mandate. And I think that will give an impetus for the next set of proof of concept type of projects.
Fantastic. Well, Keela and Ken, thank you so much for your time today. I think the conversation will continue certainly in our communities and across the blockchain and healthcare journal communities as well. And we look forward to speaking with others and working collaboratively. I think we do, Keela, have a lot of opportunities right now, even with uncertainty around what's happening. But I think that if we focus on the right outcomes for the patients and continuously think about that, I think we are in a much better place than we have been in many years. So I look forward to continuing the conversation with both of you and the rest of the community in the Blockchain and Healthcare Journal. Thank you.
Thank you, Danielle.
Thank you.
We appreciate your tuning in to BHTY's podcast series. Want to learn more or have a comment about the program? Do you have a novel topic or solution to share with our audience? If so, send an email to info@partnersindigitalhealth.com or visit the open access peer-reviewed Blockchain and Healthcare Today Platform Approaches Journal. Thanks for listening.